American Association
Retired Persons. Hey, Mr. Bill, welcome to Keel. How you doing this morning?
Hi, how are you? Welcome. Thanks for having me.
You're a pleasure. Our pleasure, sir. I am looking at the subject line for the interview. It says AARP addresses effects of COVID-19 on nursing home population. Let's start here. It's been a total screw up and nightmare. You take it from there.
It's been an absolute nightmare, Robert. Thank you. And in Louisiana, look, we know that it's been almost 1 in 4 people in nursing homes. 5,222 cases, people who have contracted COVID-19. 1,200 people have died. Across the country, it's 51,000 people now. People in nursing homes represent about 1% of the American population, but represent 40% of the people who have died of COVID-19.
Mr. Bill, pardon me. We knew early on, one of the things that we knew, of all the things we knew that now we don't know, of all the things we knew early on, was that COVID-19, that coronavirus targeted the elderly. How did this happen?
I think it is. It's really an outrage. What happened? There's a couple of things that happened, and I think the first thing is that the nursing home industry didn't get the PPE and the testing that they needed. A lot of places prioritize hospitals, but not the nursing homes. And so what happened was that in many cases, staff members got it from the community and they didn't know they had it, right? One of the things we've learned is that people can transmit this virus without even knowing they have it. And so in these settings where people are, in a nursing home setting, once one person gets it, it burns like wildfire through the whole facility. And it's been absolutely devastating. And honestly, it didn't have to be this way. And the people who live in these facilities, they really deserved better.
Bill, sorry, I'm calling you Bill. I apologize, Mr. Sweeney.
Yeah.
A lot of people that you're talking to have elderly family members, friends in these facilities and haven't been able to see them. What are the options? What can we do better about that? We need to see our loved ones. We need to make sure they're okay and eyeball them,
That's absolutely right, Aaron. I'm glad you raised that because the people need to be able to visit with their loved ones. And one of the things we're asking for is that they be allowed to do that virtually, right? All across the country, people use Zoom or they use FaceTime. There's no reason that we can't use this in a nursing home too. So people need to be able to virtually check in if they can't do it in person. They need to have those window visits. But look, we've heard horror stories. Last week, in a congressional hearing, there was a woman from Louisiana who went to a window visit to visit her mom and saw that her mom hadn't been fed in over a week. Another time she went to visit, her mom was lying naked on the floor in her room. Oh. It's really horrible, and family members need to be able to spot that kind of thing and to make sure that they can fight for their family members' rights.
Mr. Bill, it seems to me like you're taking this a lot further than coronavirus. You're saying in so many instances, the nursing home industry in this country is kind of nightmarish.
Well, in some cases it is. And we just heard last week, the Government Accountability Office put out a report that before the pandemic began, 8 out of 10 nursing homes in America had been cited for lack of proper infection control. This is basic stuff like washing your hands in between helping residents or sanitizing medical equipment. They weren't doing that in 82% of facilities. So I think that we need to get tougher on these facilities. We need to make sure that the rules are being followed and that the family members are getting the care that we're paying for.
You've talked in your release about there are proposals on that very subject to grant immunity to folks that are working in nursing homes for COVID-related illnesses or death. You're strongly opposed to that, correct?
We are. AARP is opposed to all of those proposals, and some states where there have been laws passed already, we're trying to repeal them. Because of the coronavirus, there haven't been inspections, and as you mentioned, family members haven't been able to go visit. There just hasn't been any accountability, and I think one of the things that we really need to see is that family members whose loved ones were treated poorly, like Allison from Louisiana, who testified in that committee. People should be able to get justice when something like that happens.
Mr. Bill, if my father were living, he would be, let me figure it out here, just about 104 years old. Let's assume for the moment he were alive and he were living in a nursing home. What could I do to check on him in this lockdown sort of situation, this quarantine, to be sure that the nursing home where he is doing things properly?
That's a great question. We're getting thousands of questions from people all around the country who are wondering about the same thing. We put some questions on our website at aarp.org/nursing-homes. There's 6 questions that you can ask the nursing home to find out what's going on, to really demand accountability and to demand answers. And that's your right as a family member to get that information. So, the biggest things are really asking the questions, what is happening with testing and PPE? We're still hearing, I can't believe I'm saying this on June 18th, we're still hearing that there are facilities that haven't done any testing in their nursing homes, that they're still not testing staff, they're not properly using PPE. Those are things that need to be happening right away, and family members can help to make the difference to hold them to account.
How are they being tested enough? Are those patients and my follow-up question is, would it be irresponsible of me to say, I want to bring my parent home? I don't like what's happening. I want to bring my parent home and care for that parent in the house and make sure they're separated, etc. Is that irresponsible?
Mm-hmm. No, and we've gotten that question as well. That's a really complicated question, and there's a lot of things that family members need to think about when they're evaluating that, right? Do you really have the ability to take care of your loved one? Do you have what it takes? And then there's some financial issues. Medicaid pays for a lot of nursing home care in America, and if you take your family member out of a loved one, it could jeopardize your Medicaid coverage. So we want people to make sure that they really do their homework before doing that. But in some cases, that may be the right thing for people to do.